All right, everyone, welcome to the channel. It is going to be a wonderful conversation because I have the amazing Dr. Gina Dapul Hidalgo, who is a board-certified adult and pediatric allergist and immunologist, practicing here in Maryland. She's going to
Yes.
introduce herself in a second, but we are going to be having a wonderful conversation about a very important topic, eczema or atopic dermatitis. And if you're new to the channel, go ahead and hit subscribe and hit that notification bell so you are notified whenever we have any of these conversations drop in. And again, welcome. So welcome, Dr. Gina. How are you?
Thank you. Thank you so much, Dr. Obidi, for having me. So
Oh, my
yes, I'm
pleasure.
doing
Please
great.
go
Thank you
ahead.
for
Tell
inviting
us a little
me.
bit more about yourself and where you practice, and we'll
Yes.
dive right into it.
Perfect. So yes, my name is Dr. Gina Dapul Hidalgo. I'm a board certified allergist immunologist, actually in Maryland as well. I'm closer to the DC area. And so my practice is in Rockville, Maryland, about 20-30 minutes outside of DC. And I take care of infants all the way up to adults with all types of allergic conditions. So yes, if you're in the local area and even Hagerstown, come down to see me and I'm happy to help.
Yeah, absolutely. She is an amazing physician and specialist, and this is really one of your busy seasons, right? I mean, we are. Luckily, I don't suffer from allergies, like unless the pollen count is extremely high.
Yes.
But my wife and kids all do, so this is always a miserable season for them.
Yes, it's that
Um,
time of the year.
Yes, yes. Now today though, we're not going to be talking about allergies, which is really great topic, and we can probably have you back, come talk about that another time. But we're going to talk about another very common condition, right? So it's atopic dermatitis. Now I know a lot of people call it eczema. Maybe you'll let us know the difference. But common patterns would be eczema, which
Yes.
is very common. At least I see that commonly here
Yeah.
in pediatrician. But it would be wonderful just to hear your take on it, how we can care for it, and all of that. Okay.
Yes. Yes. Happy to
First
cover
of all,
all of that.
is there a difference between atopic dermatitis and eczema?
So, eczema is like a broad umbrella that covers these different inflammatory skin conditions, but atopic dermatitis is a specific one that actually, with the words atopic and dermatitis, so really what it is where you have this inflammatory kind of chronic skin condition, and atopic means that there is an allergic component to it. So when we put that word atopic, it means that you have a genetic predisposition for these other allergic conditions. So very commonly, you'll see patients who not only have the eczema, and then we can call it that for today, but also, allergic rhinitis or hay fever, as well as asthma. And so
Yeah.
that's why a lot of the patients end up seeing us as allergists, immunologists, because these conditions come together. And so, yes, we'll call it eczema, but really the atopic means that there is some genetic predisposition. So it means likely another family member has one of these conditions too.
Yes, I was just about to say that. So, which means someone else in the family probably has it too, right? Oftentimes.
Yes.
So how early can you see eczema?
So that can be actually as early as infancy. So you probably see this, a few months of age, even as early as like 3 to 6 months. It really is a condition of early infancy and early childhood. So actually about 10 to 20% of patients or in the world have this condition, and adults, it's about 1 to 3%. So imagine 10 to 20% of kids will have this condition.
Most of
So it
it.
is, yes, very chronic. But yes, we can see it as early as infancy, but as late as adulthood.
So that actually brings me to another question, because that's probably usually one of the questions I get from parents, or at least it's implied when they're asking about this condition, which is this something that gets cured? Is it something that okay, we identify that I have eczema, or my baby has eczema, or my kids have eczema, and then we're going to do these sort of treatments, or give them this treatment or whatever we're going to do to take care of it, and now it's cured and done with, and I don't have to deal with this anymore? Is that the case?
So for some lucky patients, yes, it is the case. We do have kids who outgrow this as they get older. But for majority of patients, this can be more chronic, or what we call relapsing. So it kind of comes and goes. So it has its waves where it goes away and we're kind of treating it, and then something else triggers it, and then it might come back, and then we have to get that under control as well. So there's no cure necessarily, but there is the way to manage it and make it so that we're able to live with the condition. And then there are times where it's really not there, but being mindful of, avoiding the triggers and then treating it when it flares.
Yeah, I think that's really important, to point out, like you said, that oftentimes it's a chronic condition or something you manage. Now, like you said, it might sort of, as you get older, become something that's less of an issue.
Yes.
But that way, because I think oftentimes when we're thinking of it as something we cure, then we're frustrated when it doesn't happen right away, right? I mean, I have a headache, I take some ibuprofen, and the headache
goes away.
So my kid has eczema. I prescribe this treatment for it. It should be gone in like 2 days or 3 days, or at least 1 week.
Yes.
But that's not always the case, right? So
that's correct.
You mentioned triggers. What kinds of things can trigger one's eczema?
So great question, because this is actually one of the important things to really be mindful of, because if you can avoid these triggers, then it's less likely that you'll have the little flare that might be coming up. So triggers can be many different things, actually. They can be external, so things that you're coming into contact with in the environment. And for some, especially infants and young kids, it can be foods and internal as well. So let's give some of the more common ones. So anything from what I see too are things like allergens. So for us, it can be dust mites, pet dander, pollen. So even during pollen season, actually, if it touches the skin, that can trigger an eczema flare. Other things can be irritants. So things that we want to be mindful of as we, take care of our babies are, what type of detergent are we using? What other things are touching the skin? So a lot of irritating fabrics we want to try to avoid. So things like wool or synthetic fabrics. What are the other things that you're using to bathe the baby in the bath? So you want to be mindful of using things that are, more on the hypoallergenic side. Avoiding fragrances. So this is a big one for patients with eczema, whether you're young or you're an adult. We really want to try to, decrease the risk of touching fragrances, whether that's from inhalation of perfumes or using lotions or bath things that really smell nice. But for eczema patients, it's not the best. And we do want to try to, steer away from that and go to other, unscented and hypoallergenic products. Actually, other triggers too can be different chemicals. So things like metal. So for some people, you can be allergic to nickel, different jewelry. Other things are, rubbers. So anything that your body can come into contact with can potentially be a trigger for eczema. And going back to the foods, this is where it's an interesting thing. So, some of the kids that we see, as you start to introduce, the complementary and hypoallergenic and allergenic foods, if there is a correlation with eating the food or being introduced to it and then seeing that the eczema flares, then there may be a food component in some of these patients. So not everybody, you can introduce foods and there's no correlation with it. But when you see me as a specialist, we really dig into the history and say, wow, when you introduce this, does the eczema get worse after a couple hours, maybe the next day? In a lot of your patients, probably if, the mothers are breastfeeding, and we want to be able to say, oh, is there something in your diet that could be affecting baby? And this is when you want to see your board certified allergist to really get into the history and dig in to say, well, what could those triggers be? And then we evaluate from the history and then do appropriate diagnostic tests.
So if I heard you correctly, if there is a food component, that typically is going to see the flare up in an hour to
maybe a couple hours later.
Okay, so this is not necessarily something that will happen, 2 days down the road.
Yes, no, not typically that long. But again, it's a different thing where, for food allergies, if you have that, those are immediate reactions that typically happen, within 15, 20 minutes, up to 45 minutes or an hour. So those are our foods like milk, egg, wheat, soy, fish, shellfish, peanuts, tree nuts, and sesame seed. So if you have a food that you're eating those, and then something immediate happens, that's a different type of allergy that's more immediate, what we call
Okay.
IgE
Mhm.
mediated food allergy. But there is the possibility that these same foods can trigger eczema.
Okay, that's really good to know. And I may be getting some feedback here, so I'm going to try and put this on, see if this helps. All right. So this again is really, there we go. Can you hear me?
Yes.
All right, wonderful. All right, let's see if this helps. I don't know. So something else that I see happens every now and then is that seasons seem to also affect these flare-ups. Is that something
Yes.
that you observe, and what could be responsible for that sort of observation?
Yes, no, great question. So it's very true that certain allergens, as we talked about, as they enter the skin, can trigger the eczema. And so during different times of the year, there are different triggers that could happen. So, for example, we have pollen. And
Mhm.
certain pollen peak during certain times of the year. So the more that these are out, and these are microscopic, like super tiny, we're not able to see
Yeah.
it. But imagine that right now we're seeing yellow and green on our cars, right? That's visible. I always tell patients when it's that high, it means we really have to do our avoidance measures.
Yeah.
So when that's visible, that means that can actually come into contact with the skin.
Mm.
And then we have that, then it can trigger the eczema as it comes into contact there.
Mm.
So during spring, it's typically tree pollen. In the end of spring into summer is grass pollen. And then
Mm.
end of summer into fall are pollen. So if there's a little blip in these seasons, it might
Mm.
be these particular pollen allergens. Mold is year round. So that can be
Mhm.
indoor, outdoor mold that can trigger some eczema. But then interestingly too, we have these dust mites, which are
Mm.
these microscopic tiny creatures that can cause allergy symptoms from the nose, the asthma, as well as
Mhm.
eczema. These are also year round, but they can also get worse in the winter. So if we
Mm.
feel like the eczema is flaring in the winter, it might be these little creatures. And so you want to get tested
Interesting.
to find out if that's why you're having a winter flare.
Interesting. I think there may have been a bit of a blip in the recording when when you said what kinds of allergens do you have summer going into fall?
Oh, yes. Do you want
What
me to
was
record
Yeah,
that?
just that. Yeah, just what was that? No, just was it summer into fall was what allergen again?
Oh, summer into fall was weed pollen.
Weed. Okay. All right, that's interesting. All right. So, from all you're saying, if I do have eczema, my kid has eczema, our patients have eczema, skincare seems to have a lot to do with how you manage it, right?
Yes.
So if that's the case, what's optimal in terms of skincare?
Yes. So actually, that is the number one thing that I would, want to help your audience walk away with, which is you want to number one, know your trigger, and number two, take care of the skin barrier. So to go back a little bit, the reason why this is super important is because the reason we have eczema is that the skin barrier is impaired. So it means that there's a certain layer of the skin that is not as strong as it could be. And because of that, what happens is that it has holes. And so, because it has holes, all the nutrients and moisture evaporate out, right? It leaves the skin dry, it gets itchy, we scratch it, and the
Mm.
rash appears. So, it's this itchy, dry, scratchy rash. And that's why repairing that skin barrier is super, super important. So, how do we do this? So, one of the methods that we use is what's called the soak and seal method. So
Mm.
again, thinking about how the skin has holes, we want to really
Mhm.
hydrate that and kind of maintain it. So what we recommend, is taking baths or showers, not using hot water, but warm
Mhm.
water, and that will help to
Mhm.
bring the water back. We also then recommend really applying your moisturizer shortly after doing that. So you want to pat
Mhm.
dry. You don't want to rub the towel like we
Mhm.
mostly do. And then
Mhm.
once you do that, you still see the moisture on there. Then you're going to lather on your moisturizer, and that will help to seal the hydration of the skin over the next 24 hours. So really hydrating, and you can do it even twice a day. You know, if you wash your hands a lot, then you want to moisturize after doing that. But yes, that's why maintaining the integrity of that skin barrier is so, so important and critical in eczema.
Okay. Now, what kinds of skincare products are you using? I know you said hypoallergenic. Are there any particular brands you recommend, or what should parents be looking for, or patients be looking for when they're in the store looking for, a skincare product to use?
Yes. So there's actually a really good resource. They're called the National Eczema Association, and they have like a seal that they put on certain products that they, vet out, they look into, and that they're saying, oh, this is good for eczema skin. So some of the brand names that I do recommend, which you'll see this all at the counter when you go to the grocery store, things like Aveeno, Aquaphor, Eucerin, Sarna, Cetaphil. So all of these, Neutrogena, these are really good products. Again, some patients tolerate other products better than others. So you might find, oh, this one's not good for me. It makes me more
Yeah.
itchy. But others that you can say, oh, this one I'm good with. Let's stick with that. And again, so there's not one particular product for everybody. But once you start to see which one works best for you and your child, you can say, oh, I'm good with this. But yes, looking for that
We
seal
should
of
try a few things.
yes is helpful.
Okay. Now I know sometimes we kind of assume stuff for babies are, just hyperallergenic. So the regular baby lotions that smell nice, can those also trigger a reaction if your baby has eczema?
Yes, yes. So as we said earlier, we want to stay away from those that have fragrance. And as much as you're like, oh, it doesn't smell nice and have this, it's actually the best for the baby's skin. And things that as adults you want to stay away from too are, the stores like Bath and Body Works, and as much as they smell good,
Yeah,
these are
nice.
these are products that are just, notice you're like, wow, I put it on and now it's a little dry, or I'm itchy, or it's burning. So yes, there is the way to find out is once you start to look at it and then you see, well, what else can I use? Typically, you're going to end up realizing, oh, it's the ones that are fragrance free and have no scent.
Okay. Now, when should a patient say, okay, I've been trying these things at home. I think I need to see my, allergist, my immunologist, my, pediatrician, my
Nutrition.
family doctor. Like, I need to go in to get some extra help. At what point? Because this is something chronic, right? So
Yeah.
they can't be coming in like, every day that their rash gets flared up. So I'm assuming that, it flares up, you know what to do. But then at what point do you say, okay, I need some help here?
Help, yes. So great question, because you're able to manage this in the beginning, and as a pediatrician, you'll say to your patients, okay, we're going to moisturize.
Yeah.
But once that's not enough, then you may say, okay, we might need to try some topical therapies, whether these are topical steroids that we can put again on the skin. There are non-steroid options. And then as an adult, and actually now from 6 months and up, there are biologic therapies. So these are injectable medicines that can help with really severe eczema. So really when you want to go see a specialist is if your management of hydrating the skin is not enough and we're still getting those flares. So again, you can go from home and say, okay, let's do some, moisturizing and just really keep that skin, hydrated. But if it's still flaring and we're wondering, well, what else can we do for it? That's when I would say, before you even try over-the-counter topical steroids, seek, professional help and say, look, is this eczema? Can this be some other rash that you
Right.
think is eczema? And only a doctor who's been trained to say, oh, no, this can be this virus or, something else. Then they can appropriately manage the next steps in what's going on.
This has been so good. Thank you so very much for sharing all this great info.
Yes, of course. Happy to help educate, because with eczema it really can be this chronic condition that impacts not only the child or patient's life, but the family. right? So
Yes,
one of the
yes.
things we didn't really get into is the psychosocial aspect of what this
Oh,
does
please
to
dig into it
everybody.
because I have a few moments here to ask one or two more questions. But
Oh, yes.
absolutely, talk about that, please.
Yes. So, for those who do live with this, you'll understand what I say when patients will say, I'm scratching, or for the parents who see that the baby was scratching. I just had somebody in yesterday who said, yep, she noticed that the baby was like putting his head on
Mm,
the mattress and was just
good,
kind of like
yeah.
rubbing on it. And that's his way
Hmm.
of scratching. And so the whole thing is that we talked about this itch scratch cycle. And so
Hmm.
because we're constantly itching and scratching, it can impair how you can function on a daily basis, right?
Mm,
And impair
yeah.
your sleep. So are we sleeping well because we're
Hmm.
not able to sleep well at night?
Hmm.
Patients will say, yeah, I wake up with, blood-stained sheets on my pillowcase. And this is
Mm,
normal for those who see us. And we try to
mhm,
really encourage them to share that this is the severity of how the asthma is so that we
yeah.
can manage it based on, is it mild, moderate, or severe?
Hmm.
So we
Hmm.
really want to help, our doctors who treat eczema to say, look, we have to take care of this because it not only affects the skin, the
Mm,
appearance, but it's how they can function in school, in work,
yes.
and
Yes.
sleep. So really, it's a whole way of managing. Even though you
Yeah.
might think, oh, it's just a skin disorder, there really is
Mhm.
so much more in terms of the whole component of the patient that we take care of with this.
Yeah, no, that's such a great point because oftentimes, especially with kids, we don't realize how impactful it is on their, daily
Yes, daily
functioning.
life.
They're not paying attention or they're irritable, and maybe it's just the eczema that just needs to be managed, right? Because they're so miserable from all the irritation. Um,
Yes.
Speaking of irritation and managing, every now and then we hear things like, "Oh, you should use a bleach bath."
Ah,
What's a bleach bath, and how do you use that if at all it's useful?
yes, no, that's a good one because when I explain to patients what a bleach bath is, I get these eyes from the parents
Yes.
and the patients are like, what are you talking about? A bleach bath. But really, when you think about it, how we explain it, it's the same thing as going into a chlorinated swimming pool. Okay, because
Mm,
there's bleach in the
mm,
pool. And so,
mm,
what does this do? The reason why we recommend this is because there is a bacteria on the skin, right? So I always keep pointing here because this is where
mhm.
common spots are
Yeah.
for older
Mhm,
kids and adults, where if we have this patch of eczema, the bacteria is what we call colonized in there, and it
mm,
makes the eczema worse. So by
mhm,
that staph sitting on there, it perpetuated, it just makes it worse. And none of the
mhm,
things that we talked about get rid of that bacteria. Right.
mm.
So if you think about it, we're just
Yeah.
moisturizing. So how do we
Yeah.
get rid of this bacteria? It's by hopping into a chlorinated swimming pool or
Mm,
making this bleach bath at home. And again, you should see your
mm,
doctor and provider to tell
mhm,
you how to do this.
mhm,
But the idea is that it kills it off. And then
mm,
it's something where you can do it every couple weeks, every couple
mm,
months, and really helps to maintain that so that we can get rid of one of the triggers, which is that
mhm.
bacteria that sits on the skin. So yes, it is
That's it.
it's a
So it is a
legitimate.
thing.
Yes, it is a thing. It's not something that you're like,
That's for clothes, for stains on clothes. All right, wonderful. Well, yeah, but that makes sense how you explain that. We're already doing that all summer long when we're jumping into
yes,
colds,
yes,
right?
jumping into clothes.
Well, something else I see, and I'm sure those who have eczema can attest to, is that every now and then your skin can go through color changes. Sometimes they're like
Yes.
really light spots or they're really dark spots. Sometimes the light spots may be from maybe using too much of a steroid cream. Like,
Steroid.
how do you manage those? What causes them and how do you manage those?
Yes, so that's an interesting one because it can actually be part of the eczema itself, where you have
Mm-hmm.
the darkening of the skin tone,
Mm-hmm.
where you can get crusting, oozing, what we call lichenification, which is where it's kind of like a leathery type of skin.
Mm-hmm.
And because it becomes that, that's how the skin can heal. So it can heal lighter or darker than the normal skin tone,
Mm-hmm.
as well as just be part of the eczema itself. But as you had mentioned, it can be a result of the treatment that we're using
Okay.
to manage the eczema.
Mm-hmm.
So how we treat this is really getting at the skin barrier, as we talked about, as well as using the therapies that help to heal the eczema and manage it, because then that will help the discoloration down the line. So it's really managing and controlling the eczema, because this is just how some people's skin heals.
Okay, so the better you take care of your skin, the better of a chance of that recovering or at least not getting worse.
Yes.
Wonderful.
Yes.
Oh, thank you so very much. Any last tips for parents, for our patients who, you know, have to deal with eczema and it, you know, and its consequences? What little last pearls can you leave with us?
Yes. So the last 3 tips I would, like to recommend and make sure patients and everybody take away. Number 1, know your triggers. So again, keep in mind, what is it that makes it worse when it pops up, and being very mindful of that. Even something as simple as the weather. I forgot to mention that, cold weather, hot weather, and we're sweaty.
Yeah.
That can trigger it. Again, all these external factors. So being mindful of your triggers. Number 2, really finding that bathing and moisturizing regimen that works for you. This is going to be your daily thing, right? And then number 3 is then seeking out help so that you can get the proper either over-the-counter or prescription medications that are either topical or more systemic to help manage this, so that you can live the life that you want to outside of our doctor's offices and, be comfortable in your own skin and really be fine with, okay, I have eczema, but I can do everything I want to, in elementary school, high school, and parents taking care of your infants, really trying to support the patient, the baby, and let them live their life, but just eczema be this thing that we kind of have to deal with
and take care of effectively. Thank you so very much. This is the amazing Dr. Dapul Hidalgo. Thank you so much for taking our time to go over this all-important topic with us. So tell us, how can people get in touch with you? I know you have a presence online. I know you do some education online, but you also have a practice in the area. How can people get to find you?
Yes, I have, I'm the CEO and founder of Family Center for Allergy and Asthma, located in Rockville, Maryland. And we can be found on our website at dapulallergy.com. That's DAPULALLERGY.com. And you can find me on Instagram and Facebook at Dr. Dapul.allergy. That's DAPUL.ALLERGY. So follow us, give us a call. I'm happy to serve our patients here in the local DC, Western Maryland area, and happy to serve in any way to help you.
Sweet. Thank you so very much for coming on. We're going to have those in the descriptions so you can check out that information down there. Thank you again for coming on, and have a wonderful day.
Thank you. You too, Dr. Obidi.